safe streets, vibrant neighborhoods, successful business and commerce. These are things that make a healthy community. We are a diverse community, rural, suburban, urban, a multitude of languages and ethnicities, ages and experiences. We are a collaborative community. Public-private partnerships make us a model community that others want to follow. It is what makes us unique. It is what makes us strong. The employees of Kent County reflect our diversity and seek to serve our communities.
People in this county, in this area, we wrap our arms around each other. We come together to collaborate, to solve problems. We're all working for the good of the whole. And I think that's wonderful. And you can see it. You can see it as you drive around Kent County.
Our impact starts the day a baby is born and a birth certificate is issued, to protecting children from deadly diseases through vaccination, to the public safety and justice provided by law enforcement and the courts, to offering veteran services and caring for the elderly. Every day we work to keep our communities robust.
I think if you are somebody who is interested in serving your community, in building a strong knowledge base and a good group of people to work with, then the county is one of your best employment opportunities out there. It's been completely rewarding in every way I could possibly explain for 26 years, and I feel like I grow every single day still today.
Leading these dedicated employees, our 19-member Board of Commissioners and our County Administrator Controller, along with our elected officials and appointed department directors, placing emphasis on civic involvement, quality housing, vibrant neighborhoods, and strong, solid infrastructure to allow businesses to thrive. Professional, dedicated, collaborative, and innovative.
Behind the scenes, collaboration between foundations, charitable organizations, nonprofits, for-profit businesses, public sector demonstrated through the county, the city of Grand Rapids, the townships, all the cities and the villages in our area. If we don't come together, then we will not have the strength that we have today, and I only hope to build upon that.
Our aim is to make our communities the best they can be. We are involved in exciting development projects, sustainable recycling programs, and creative progressive prevention programming. We partner with elected officials, impacting policy ideas that become great achievements. We seek opportunities to reach out into the community and offer our services to help our residents make Kent County thrive.
Our relationship is solid, both from a staff standpoint at the county level as well as the Board of Commissioners. And they understand what we do and the benefits that we can do for the community, and vice versa. We couldn't do what we do without the help of Kent County.
While most of us are busy running our lives, Kent County's elected officials, administrator controller, and over 1,600 employees are serving the communities where we live our lives, so we can all have a place we are proud to call home. Kent County, its life well run.
It is a little after 8:30. Good morning. I'll call to order the Legislative and Human Resource Committee. We will start the agenda with public comment. If anyone wishes to address the committee, you may do so. Approach the podium, and you will have up to 3 minutes to address the committee.
State their name and address.
If you would state your name and address before you make your comments, please.
My name is Douglas Edward Scheidel. I'm a Kent County resident. I live in Alpine Township, Kent County, Michigan. On May 15th, 2012, I was hit head-on by a Cadillac, where the state of Michigan issued a certificate of title 298 Bravo 2490158 for VIN number 1 George 6 David Michael 57 Nora X-ray 30131819. And in that report, the officer has 2 victims when there was only one in 2 locations. By the virtue of having me in 2 locations, he's violated the Michigan Penal Code Excerpt Act 328 of 1931 under assaulting, battering, resisting, obstructing, opposing person performing duty, as he never forwarded it to the traffic crash. It went through court in June of 2012. The traffic crash unit was never informed until November 15th of 2012, brought from my attention. So therefore, the traffic crash investigator was never afforded the ability to investigate. The pictures in the packet that I showed you will show the milk spatter painted all the way down the passenger side of the car, which means it's a high rate of impact. If I hit the way the officer said I would, the milk that was spattered would have left a trail. It does not. When she hit the brake and parked on my back tire, the milk spatter shows the direction I left the windshield, over the hood. Reversing the bicycle, allowing her to park on the back tire. I have the recording from that investigation on June 21st of 2013 from the Ron Gates, the internal affairs officer. He denies and continues to willfully neglect his duty, which is in direct violation of the Michigan Penal Code Act 328 of 1931, section 750.122, prohibited acts. By placing me in 2 locations, he has committed a crime because that goes directly against the prohibited acts. As a survivor, the amount of money that was spent on my medical bills after Medicare had paid for the auto insurance responsibility is doubled, and if it was the regular cost of anybody else, would be triple the Catastrophic Claims Act, and they refused to investigate. You'll see in there that I also have an article that came from News 8's website, which was printed at 2:50 p.m. The only person that knew that evidence was the police dispatch. And
Mr. Seidel, I'm sorry, but your 3 minutes is up.
Okay, thank you. I will be glad to answer any questions after the meeting and play the tape for you.
Thank you, Mr. Scheidel, and we also received your materials that were submitted to the commissioners. Anyone else? All right, if not, we'll move to item number 2, which is approval of the minutes of August 27. Is there a motion? So moved. It is moved and supported. You got it? Okay. Any conversation? If not, all those in favor say aye. Aye. Opposed, the same. It is approved. All right. Becky has arrived. Good. Next item of business is the Public Affairs Associates. Becky Beckler will give us an update on legislative activity and specifically inform us that a budget was signed. No, I'm just kidding. Go ahead.
Then I'll need to come back at a later time. Well, good morning, everyone. We are exactly 1 week out from our new fiscal year, which begins October 1. And as the chair has indicated, we do not have a state budget agreement yet. However, there will be a significant amount of activity today to try to get one. As you know, the governor has not participated in recent conversations regarding the budget. She continues to want a long-term funding plan for roads, and the legislature does not want to handle that situation within this budget. They want to do the budget and then continue to discuss a long-term plan. So the governor has not participated in this recent budget negotiations. However, the House and the Senate are going to move forward with conference reports. They actually plan to move 17 of them today. The K-12 and Department of Education was approved last week by the House and the Senate. So that is on this way to the governor, and today they will do the remaining budgets. It's uncertain what the governor plans to do once she receives those budgets. I think most thinking in Lansing is that she will line item veto a significant portion of all of these budgets, restarting the budget process, if you will, and just the only issues that she would not veto with those issues that are important for government functions. But everything else she could line item veto, which sets the stage for a pretty significant supplemental down the road. But there are a number of issues that we are watching in several of the budgets that pertain to Kent County that I wanted to run through with you this morning. We'll watch those to see if we believe they will be included in the conference reports. However, whether the governor line item vetoes them or not is something we're going to need to watch closely over the coming days. There are quite a few items within the Health and Human Services conference report. The House and the Senate added $6 million to local public health department funding. That goes to essential services within health departments. They also ordered boilerplate language that I think is very helpful to our county local public health departments, refunding formula, as well as indicating that county local public health departments cannot receive less than they received last year. Last year, the budget also indicated additional funding for them, so this is good news that we're trending in the right direction. There's also $3.4 million for a lead exposure response for communities. It's one-time funding for healthcare, food and nutrition, lead abatement, and other services statewide to communities for lead contamination in water, soil, and housing that causes human health consequences. We're watching that closely, whether that could be something where the county could activate those funds should it remain. Both the House and the Senate agreed to continue to fund Pathways to Potential. That's something that's been important to Kent County. All they did is change some boilerplate, reducing some reporting requirements for that program. For our private adoption and foster care agencies, they will receive slight bumps in adoption rates. They received $1 million increase in that, as well as Family Preservation Program. There was a slight bump of $2.1 million for those efforts. There's a couple pilot programs I also bring to your attention. One of those is a $600,000 fund. It's one-time funding to fund 3 pilot programs, one in Wayne, Genesee, and then Kent County for wraparound services before and after school programs. There's also a $600,000 pilot program for opioid addiction. This is mirroring what has been done in the western Wayne County. The Trinity Health System has implemented a pilot program in that area, and they want to duplicate it here in Kent County. And so there is money to try to begin those efforts. The House and the Senate also concurred with the governor's original proposal to add $200 million to support an estimated 2.75 increase for our prepaid inpatient health plans, which is our PIHPs. This isn't a significant increase. It's also estimated a 5.75% increase for autism services and an estimated 2% for actual sound adjustments to Medicaid health plans and Healthy Kids Dental. As you know, the PIHPs across the state are struggling financially, and this is one way to move forward as far as helping them with their finances. Behavioral health integrated pilots. As you know, probably 2 budgets ago, the legislature had wanted to implement 3 pilots throughout the state integrating behavioral health. None of those pilots have actually got off the ground, yet the legislature has put in additional language calling for statewide integration by 2022. This could be problematic in the fact that we don't even have the pilots going, and yet the legislature wants statewide integration by 2022. If it's just boilerplate, it's difficult for the governor to veto. She could veto the entire section, however, and ask the legislature to start over. So we'll be watching that closely because some of the language in there could be problematic to the county. Section 928 is good news in the fact that we've continued that agreement on the state pays first when it comes to the child care fund. And there's $5 million in which to continue that program as well, which is something that's significant for Kent County. In the general government budget, the counties are going to receive a 2.3% increase in revenue sharing. The governor had proposed a 3% increase, so this is a slight reduction, but it's more than what we received last year, so we'll see what the governor does with that. Within the Veterans and Military Affairs Conference Report, the County Veterans Service Fund, the legislature fully funded that at $4 million. The governor had proposed reducing that to $2.1 million. This is a grant to counties for veteran services to include advocacy, advice, and assistance in obtaining eligible activities and services. Within the Corrections Conference Report, we were disappointed that the community corrections line was reduced by $400,000. It's something that the House was insisted on. They believe there are lapsed funds. We disagree with that assessment, so we'll be hoping that the governor will perhaps veto that line and have that restored, or we can get it restored in the supplemental, but we're watching that closely. There's also some boilerplate there connecting county jail reimbursement to how we interact with federal agencies, and we're watching that. Within the Transportation Conference Report, and this is the one where the governor disagrees with the legislature, they did include $400 million in one-time funding for roads, and that's in addition to $468 million that's required for road funding for the 2015 plan. So there are actually 2 separate pots for road funding within the Transportation Conference Report. So those are the issues that we are watching closely. Again, we're uncertain as to what the governor will do. We believe that she'll probably get it as early as probably Thursday. They plan to vote on all of them on today and move them, but it does take a couple days to actually transfer them to the governor. And she only has until October 1 to make her decisions, which isn't a lot of time to go over a significant number of budgets. We were hoping that the Raise the Age package, which has been sitting on the House floor, would also be included in the budget negotiation, and it hasn't, simply because of the breakdown in communication. However, we believe that the legislature plans to move it in October. They're going to change the formula somewhat because it's been sitting there a while. The budget complications will have to move to 221, with kids being moved starting with 2022. So that is the plan right now with Raise the Age. It's been approved by both the House and the Senate months ago. They were hopeful that it could be part of the budget conversation. It's not, but they plan to continue to move it. We're one of just 4 states, and we might even be less. We're trying to be not the last state to move that direction, but it looks like we might be, simply because of the implications. There was also a committee meeting last week in Senate local government. There's a package of bills introduced by Senator McBroom from the Upper Peninsula, who is seeking to move the election time for county commissioners from 2 years to 4 years. That's had one hearing. I'll continue to follow that for you, but it has not moved forward since that one hearing. I know that's run through quite a bit quickly. If there's any questions, I'd be happy to answer them.
Good, thank you, Becky. A lot there. Any questions? Yes, Commissioner Ponstein.
Thank you, Chair Smith. Becky, welcome to Kent County. On the county commission 4-year terms, I know it's still early, the hearings were just last week, but in that bill, is it going to stagger the terms, or is it all 19 in our case are going to be up at the same time? Or has there been changes when they maybe split that?
You know, I'm not certain, but I'd be happy to go back and ask Senator McBroom what his long-term plan is and get back with you today.
Okay. And, one of the issues at our recycling plant is when bottles come in from the bottle bill into our facility, we don't get reimbursed for them. There's been always talk of maybe re-looking on how that's allocated. I know the state gets 50%, the retailers get 25%, and the other 25%. If we're going through the cost to recycle those products, we feel that we should be at the table. Someone from Eagle speak that someone has an outside group propose something to kind of change that. That had any legs? Have you heard anything of making the recycling centers that are also collecting these not even getting?
Yes, I believe there have been some work groups, and when I say work groups, these have been in place for several years. But I don't know if they've come to any conclusions, but I'd be happy to check on the status of that and whether that's included as part of one of their conclusions and recommendations going forward. And I'll also see if there's a time frame for this work group.
Who is the outside group pushing this?
That I don't know, but I'd be happy to check. Mm-hmm.
Yes, Commissioner Tallon.
Chair, I'm not sure if this is a Becky question or someone else, but it's legislative, and wondering where things are at with Kent County and the opioid litigation and settlement talks and all that kind of stuff. Is that?
That's probably a question for council.
What I can tell you is that I've gotten an initial update from our outside counsel last week, and things are moving forward toward some discussions on some settlement ideas. But there are a lot of moving parts, a lot of players at various different levels, from locals to counties to states. So it's going to take a little bit yet, but I did receive an update, and I was going to pass that along through Wayman for the board, probably in his next administrator's report.
Is it something where the state has to opt in or opt out of a settlement that could affect
If it were only that simple.
Okay.
There are 2,300 separate parties that have gotten into the opioid litigation.
So it's us and the state of Michigan.
The state has not officially entered into it, but they are at the table.
And is that, folks that are at the table, are those legislators or they're more state staff?
More litigators, and then the federal district judge out of Ohio has put together in his courthouse, a small select group that are trying to steer some of these conversations, similar to the way tobacco was negotiated out. Can't have 2,300 people in one room.
Yeah, thank you.
Commissioner Melton.
Thank you, Chair. Good morning, Becky. I love listening to your reports, by the way. I know I've told you that. The $3.4 million for lead abatement, and you said if I heard you correctly, again, you to kind of go through it fast, that it will be dealing with testing of water and soil testing, or just checking, or, well, I guess those are about the same, or, and then housing. Is this something that we, because we have 2 zip codes that are the highest lead in the state of Michigan, should we be actively seeking that, or will that come in our direction, or how can we better utilize that?
That's an excellent question. Well, our first initial is to make sure that it's included. If the governor vetoes it, then we'll need to go back to the table.
Okay.
If it remains, then I think what we probably should do is meet with the Department of Health and Human Services to see how they plan to implement this one-time funding, whether it be a grant process, how to apply, and get details on how they plan to pursue it and who would qualify. So I think that would be a couple steps, have it included, and then meeting with the department to get some more details.
Okay, so will we be in contact with you? You'll let us know, or I mean, by us, I'm not sure if it would be Chair Bolter or if it would be
I will work with the
Chair Stack or whomever.
administrator's office.
Administrators. And then you would let us know.
Yeah, we
because-
talked about this last week. Becky was here, worked with the department directors, and we also talked about this last week. She gave an update, so we
Okay.
will keep on task with the department as well
Okay,
as
'cause
Becky.
we don't want to miss out on whatever we can possibly get out of that. Thank you.
Anyone else? If not, I do have just a couple of questions. Have you been tracking, I think it is House Bill 4325, dealing with the qualifications for counselors, which is currently being considered, has some potential risk or impact on the availability of counselors in an environment that we badly need them. What is the status of that, or can you get back to us on that?
Yes, I will get back with you because this has been a highly controversial issue. It was an issue brought up last session, and the different counseling entities are fighting amongst each other, and I know that Representative Alpal, who chairs the House Health Policy Committee, would like to get this moving forward. So let me check with him. I believe it was scheduled for a hearing either last week or this week, and let me see what the status is, and I will get back with you on that. But it's something that has been on the forefront, especially in the House, of trying to get some conclusions to move forward.
Okay, good, thank you.
Absolutely.
And then I think last month when you were here, we were speculating it's not very likely we wouldn't have a budget, and here we are without a budget. If the governor were to choose the heavier approach, which I suppose is veto or not sign the budget at all, and we face a close down of the state government, is there a point where we begin to see a cash flow impact at the county level? And if so, when is that?
All good questions. Yes, I believe that the county would be impacted when it comes to county revenue sharing. It sounds like from the governor's conversations and comments that she's made previously, that her plan is not to shut down government. However, she could still have the same impact by line item veto significant portions of the bill, so that you would only keep intact those essential services, and then force the legislature back to the table on all the other components within the budget. But she's been pretty careful about how she plans to move forward. She has been publicly stating that she didn't want to shut down government. I don't believe that is her plan, but she could almost get the same effect, keeping the essential services by line item vetoing
A lot, yeah.
almost everything.
Yeah.
Yeah.
Well, it'll be an interesting couple of weeks.
Yes, it will.
Good. Anything else? If not, thank you, Becky,
Thank you.
for your report.
Absolutely.
All right, our next item is a performance measurement review on the Health Department, and Adam London is here with us this morning.
Pass around our latest opioid surveillance report. You know that as well. Good morning.
Good morning.
I know you received our performance measures. I would like to say that many of our measures are what I call under construction right now. And as a result of your good work with strategic planning, that's causing us to look at our strat plan to make sure that ours aligns with yours. And that's an opportunity for us to look at all of our measures and to make sure that they're serving the goals and objectives that we want to accomplish as a community. I'll briefly cover our alignment with your priorities, some of our key performance metrics. And I'm going to include a couple that probably weren't included in your measures, including how we're doing with lead and opioids. Some significant budget issues, some significant accomplishments, some key collaborations, and a look ahead to things that we're working on now and in the near future. So here on the left column, you'll see the 5 priorities that you as a board decide upon with your strat planning. And briefly on the right, how I think that we align with that at the Health Department. Economic prosperity. I think that we don't have economic prosperity in this community unless we have strong families. And the work that we do to strengthen our families and get kids off to a great start, especially the most vulnerable kids, is really important. Food safety. And the work that we do with over 2,000 establishments to make sure that they're successful. And that foodborne illness isn't part of our story here in Kent County. It is important to those industries. It's important to our reputation and to tourism here in West Michigan. The huge events that we have, they're a lot of fun. They're also a lot of work behind the scenes and making sure that things like Festival of the Arts go off successfully, and that once again, it's not known as Festival of the Foodborne Illness, but Festival of the Arts is really important to us. And it's important to the event organizers as well. Housing and development is something that's important to us with well and septic permits, and making sure that we're making good decisions and supporting our home builders to move and to build as quickly as possible in as safe a way, responsible of a way as possible. High quality of life. Pretty obvious that we can't have a high quality of life here if we have a high rate of illness and injury in Kent County. So we have a key role in keeping a low prevalence of illness, disease, and the risk factors associated with them. Excellence in service delivery. I think we're doing a pretty good job. We're fully accredited with the state of Michigan, with the national accreditation, and with Project Public Health Ready, which is in response to emergency disasters. I'm a little leery to say that we're excellent. I think once you do that, you start to miss things. And so we're striving for excellence. We recognize we have work to do, and we're going to continue to pursue excellence. Inclusive participation. We have a refugee engagement committee that works with those who have recently arrived here in the U.S., here in West Michigan, from a number of countries as refugees through the State Department's program. We have a number of consumer councils, from vaccines to food safety. We have our health equity and social justice trainings that we've offered for close to 1,000 people now throughout Kent County. That we work with organizations to train their staff on health, equity, and social justice. And then effective communications. I think that we're really a leader in that, and we have taken a space that was formerly underused as a storage closet, and turned it into something, to Steve Kelso's great delight, that we now call Studio Kent. And through our Studio Kent, we have done a number of videos, trainings, outreach. It's where we host most of our media events and interviews now, and something we're looking at expanding to even greater extent to serve the people of Kent. And then our mission, I think, is aligned with your priorities to serve, protect, and promote a healthy community for all. And I always tell our staff, especially our new staff, that the most important words there are the first word and the last word: serve all. And that's what we hope our culture and our ethic is about at Kent County Health Department. The first goal measure that I want to mention is one that's in administration, and that's to provide overall leadership and support to the department, and that really begins with epidemiology. Our epidemiology in public health is it's the windshield, it's the dashboard of what we do. Without good epidemiology and a response to what's making people sick in Kent County, we can't do our job. And so I've included an image here of Legionnaires disease and the Legionella bacteria because that's one example of many that we have seen an increase in the reporting of here in the past year. We've had at least 6 cases of Legionnaires disease reported this year. I think part of that is due to greater surveillance and greater reporting on the part of our medical community, but it's something that we're very attuned to as well, in that we're seeing through greater surveillance and greater testing more illnesses, a greater diversity of illnesses reported to us, which stresses our team, challenges them. The objective that we have is to complete 95% of these disease reports, and that's more than the investigation. That's the full report within 30 days. And you'll see from our numbers over the past several years, we have increased that percentage of those reports in 30 days, but also the total number of illnesses that are reported to us to investigate has gone up pretty significantly as well, from a little over 2,600 in 2016 to over 3,200 last year. And again, I don't think it means that we are a sicker community. I think it's largely due to the better systems, the better communication and connectivity we have with our medical community so that they're reporting, testing, and providing those reports to us in a timely way. Lead is the secondary I want to touch upon. And the image that is before you is one that I think is important. It's something that we learned during our task force investigation last year, and that our problems, as they are here in Kent County, are not related to water. They're largely not water related. We have a huge problem with lead in paint and lead in dust and lead in the soil. The goal that we have within our community wellness division is to have 95%, at least 95% of the children that we test at KCHD have a blood lead level of less than 5 micrograms per deciliter. That percentage has increased over the past few years, so we're seeing fewer cases of elevated blood lead in our own clinic. The goal we have for 2019 is 95%. I actually would like to see it much higher than that. I have a couple slides I want to show you from our environmental epidemiologist looking at the rates of blood lead levels here in Kent County. Now, this one I want to caution you has some asterisks with it. Overall, you can see that our rate, generally speaking, has trended downward with elevated blood lead in Kent County. You'll see in 2015 we had a spike, and that's what caused us to respond with the lead task force and those interventions. After that point, because of a number of the improvements that we've made, I would caution that it's difficult to compare post-lead task force numbers with pre-lead task force numbers, because afterwards we started doing more recommendations for universal testing. So we have more kids tested throughout all of Kent County now, which is causing a bigger picture, but more data that perhaps is watering down in some areas the appearance of EBL. We're also doing far more venous blood draws. So traditionally, lead has been tested with a capillary blood draw, which is prone to false highs because of contamination on the skin. We're now doing far more venous blood draws because it's a much greater quality blood test and more reliable. And this image, this graphic, I think is very interesting and maybe somewhat new data for the public health community. Shows month by month our elevated blood lead results. And what you'll see for each month, the gray bar is the total number of kids that were tested. The smaller blue bar is the number of kids that had an elevated blood lead level. greater than the 5 micrograms per deciliter. So those are the high numbers at the bottom. The line going through the graphic is the percentage month by month. And so it was a bit of a surprise to us to see that in the summertime is when we see the highest percentage of kids with elevated blood lead levels, which seems to be somewhat contrary to what you may think, because in the wintertime is when kids spend the most time inside where the paint is at. The reason that we believe it is behind this is that there's a lot of dust in the soil. And that's because of paint chipping off the side of homes over the years. It's because up until the 90s there was lead in gasoline, and that all settled into the soil as well. And so in the summertime, there's no snow cover, obviously. Kids are outside more, windows are open, there's more agitation of the dust outside. So there are other strategies besides the cleaning of the inside of the house that we need to look at, like landscaping, that we learned about during the lead task force process in order to help protect kids from lead dust on the outside, along with better construction practices, both for road work and for renovation and demolition work. Opioids has been another significant public health crisis that we've been working on. Our objective here is to reduce the incidence of opioid overdose deaths to less than pre-epidemic rate, and that number, based on our historical, is about 5 per 100,000 would be the pre-epidemic rate of opioid overdose. Looking back to 2016, it's gone from 9.7 to 2017 was our high point here in Kent County with 104 deaths, and that's a rate of 15.8. Last year was 10.2 with 66 deaths, and we hope to see less than 10, a rate of less than 10 and less than 65 deaths this year. This graphic here is a accumulator which shows over the course of these 3 years the cumulative opioid overdose deaths through the course of the year. The blue line is 2017, and you see how those deaths accumulated through the year and ended at 405 deaths at the end of 2017. The orange line is 2018, and you can see in about May of 2018, the trajectory of that line started to trend a little less severely. We ended 2018 with 66 deaths, and you'll see the line for 2019, we're trending lower than the previous 2 years, and while our goal is less than 65, I'm really hoping that we lower than that. This is a very busy graphic, but I included it because I wanted to give you some perspective of how we're doing in Kent County compared with other large counties in the state. The dotted line is the state of Michigan rate this is a rate per 100,000 of population. The light blue near the bottom of that cluster of lines is our Kent County rate year over year going back to 2007. See that we have been noticeably lower than Wayne County and Macomb County, Genesee, Washtenaw, Ingham. The Ottawa County data, we don't have as much data from them. We don't have as large of a series of years from Ottawa County, but it mirrors pretty closely the Ottawa or the Kent County rate. And the Oakland County rate, which is way at the bottom, I don't have a lot of confidence in that number. I'm not sure what they're doing or how they're measuring. Questions about why their rate is so significant. Some significant budget issues that we're looking at, and as Becky mentioned, we're pleased to see that the budget as it's currently proposed includes $6 million more in essential local public health services. We have been advocating for many years. I know many of you have also been advocating for a long time about the need for the state to to fully share the cost of the mandated public health programs. This $6 million will help. It doesn't quite get us there, but it gets us pretty close. In Kent County, we've been at about 42, 43% funding of our mandated programs by the state. This will get us probably to 48% or thereabout. And that $6 million, as I think Becky mentioned, is not for Kent County. That's statewide for the 45 health departments. So we'll get a slice of it if the governor signs it as proposed. On the bad side, we've got a couple of concerns. We recently learned that Spectrum Health has cut their funding, their support of the Fetal and Infant Mortality Review Program. They had a staff person who was responsible for gathering the fetal and infant mortality data and leading the community work group, looking at those data and trying to identify what the issues were. It's an area that has accomplished a great deal in the past, going back to 2003 when it was created, in that we have pretty dramatically reduced the rate of infant mortality in Kent County and reduced the disparity between the Black and the Hispanic infant mortality rates and the white infant mortality rate. So we're looking at ways that we might be able to continue that work with the mortality review. We also learned that Mercy Health St. Mary's is cutting funding for asthma care management, and this is a preventative asthma care program that they had been funding. We're looking at ways to actually consider this maybe as an opportunity, because some of those services that they've been providing to families that have kids with asthma are actually reimbursable through Medicaid and through insurance. So maybe an opportunity where we can look at providing some of those services and also delivering some lead prevention, because the two, so maybe an opportunity that we can leverage this gap with another need as well. And then we're always concerned about new and emerging issues. In the past several years, we've had PFAS, vapor intrusion, Zika virus, Legionnaires disease. There's always something new and oftentimes something old on the horizon. We had the outbreaks of mumps at the colleges a couple of years ago. We're gravely concerned about measles and influenza and what those mean to us and our ability to serve the community. Three things I want to brag about. Number one is our expanded oral health programming in our clinics division to provide fluoride varnish to almost 3,000 children and a similar number of oral screenings. Fluoride varnish is a great way to help prevent cavities. Dental pain along with untreated asthma are two of the leading reasons why kids miss school. And if we can prevent some of this through what's really a pretty quick procedure to do the fluoride varnish, we're pretty proud of that. I know that I've got Christopher Medecki with me this morning. He is the division director in the clinics division. I know that that was quite an undertaking, getting the training to the staff to be able to do this, and he had some resistance from people that, how are we going to find time to do this? Well, they found time, and they found a way to get it done and to really serve these kids, these families better. Increased live release rate at the animal shelter. Pretty dramatic. We've gone from 8-9 years ago having a live release rate in the upper 20% range, and this is the percentage of animals that we received either because we captured them, they were running stray, or they were surrendered to us, or people brought them to us and surrendered them. The percentage that actually leave the shelter alive, either as a transfer to a different organization or as an adoption, or a return to its owner. And you'll see that we have moved that number from the high 20% range to 77% so far in this, that's fiscal year, and actually in this calendar year, we're up around 80%. And that's because of a lot of reasons. We've really expanded our network of transfer partners, having a broad network of organizations that are that have the space and the capacity to deal with some of these issues, that have maybe some specific subject matter expertise where they can help dogs or cats that have challenging issues has been important. We've also looked at and improved our temperament testing so that we're using the latest of the art, latest science in determining which dogs and cats are really a danger and which ones are safe to put up for adoption. We've had a number of people say, well, we'd like for the Kent County Animal Shelter to be a zero-kill shelter, and that can't happen. And that would be an inhumane and dangerous thing if we were to become a zero-kill shelter. The reason for that is, well, number one, we have many people who can't afford to take their suffering animal to a vet for euthanasia, so we have a low-cost euthanasia at the animal shelter. So it would be inhumane for us to turn them away and allow that terminally ill cat or dog to go back home. But also, we are the only place that can't turn away the most aggressive, the most dangerous animals. And there are some, unfortunately, there are some dogs that there is no really safe option. As tough as it is, we're always going to have that responsibility to take care of. We're also proud that we received a Model Practice Award from the National Association of County and City Health Officials last year. This is for our Inclusive Disaster Preparedness Program, which is a program that Carla Black and Pat Draper from our Emergency Preparedness team developed, recognizing that not everyone has the same abilities and the same capacity to prepare for disasters, and that we have many people in our community that have different levels of ability than the average person. And also recognizing that while not everyone can do everything, everyone can do something to be better prepared for disasters. And so they developed this program where we listen to the people that come to the training to find out what their abilities are, what they can do, and we work with them to coach them to be as prepared as possible with their abilities. We've had over 100 people attend the training so far this year. The importance of this is this recognition puts that program on a national inventory of best practices that NACCHO then shares with other health departments and counties across the country and encourages them to consider doing similar programs locally. A few key collaborations. The Kent County Opioid Task Force is really the group that is responsible for much of the improvement that we've seen in the decrease in opioid overdose rates. The task force that we pulled together, which includes pharmacies and law enforcement, includes therapists and schools and a whole variety of sectors in our community. If you want to find out more about the work they're doing, I would encourage you to follow them on Facebook at Kent County Opioid Task Force. They meet monthly. They're focused on preventing addiction to begin with. They're focused on reversal of overdoses when they happen, and they've done a ton of training and distributed a lot of naloxone kits in the community. And they're focused on aftercare. So once we've identified someone who has a challenge with substance use and has had an overdose, how do we make sure that they're getting the follow-up and care that they need in order to beat that use? Our PFAS exposure assessment partnership with the Michigan Department of Health and Human Services. We held 12 clinics earlier this year, mostly on Saturdays, serving over 400 people, doing blood samples, and that work with the data is now continuing. I was also happy to see yesterday that the state was one of 7 to receive $1 million from the CDC for a health assessment study, which is really kind of the next chapter in this study. One of the things we heard from the community as we first responded to the PFAS situation was that there's not a lot known, and that's unfortunate, but it would be a shame if we didn't learn everything that we can learn from what happened here, what the effect on the people who were exposed to the PFAS was, and what the ongoing health consequences may be. And between the exposure assessment and now the health assessment, I think we collectively have done a good job in bringing all of the resources of federal, state, and local government to really understand what this means so that we can better care for our community, but also provide information to other communities across the country so they can serve their people as well. Kent County Population Health Consortium is another collaboration that is really well positioned to do great work. Wayman and I have done a lot of work in bringing this consortium together, which is a partnership between the county, the 5 nonprofit healthcare systems we have, Grand Valley, Network 180, and a variety of other nonprofits through the community. Recognizing that none of us has the ability to overcome these big, wicked problems such as lead and opioids, suicide, and so many other things that are bigger than any one system to address. Find out more information about the Population Health Consortium at betterhealthkent.org. Looking forward, we're in the midst of our accreditation season. We just had our accreditation with the state of Michigan. Happy to say that we fully passed that with commendation from the state. Public Health Accreditation Board is the national accreditation that we're preparing for now. And Project Public Health Ready is an accreditation focused on emergency preparedness and disaster readiness. And I think we're one of the very few counties in the state of Michigan to have all 3 of these accreditations. I mentioned the PFAS health assessment and that we're gearing up for that. Violent ethylene oxide is a situation that we're watching very closely. I know there was a release from EGLE, the Department of Environment, Great Lakes and Energy yesterday, talking about the fine that they're imposing on Viant and their proposal that Viant cease all use of ethylene oxide by December 31st of this year. There is a public hearing being held on October 23rd in the evening at Grand Valley's downtown campus. We have looked at the community in relation to cancer with cancer registry data, and we have not found, and I say we, I mean the county along with the state, have not found any significant differences in cancer rate in that area. However, we do know that ethylene oxide is a carcinogen. It's a dangerous chemical and not something that we want to be exposed to long term. I have asked EPA, CDC, and the state, is there an immediate threat to the health of the people in that community? They have said no. This is a concern for chronic long-term exposure. However, you know, we need to see this situation be resolved as soon as possible, and I would encourage. Attend that meeting on October 23rd. Mental health crisis planning, crisis center planning. We're very close. I think it goes to the full board on Thursday. The contract for Tri-West to do the planning for the mental health crisis center, which was brought to us by the task force that Commissioner Steck and others have been involved with. That process has now been handed over to the Population Health Consortium to take forward, and with Tri-West to be the planning consultant. Strategic planning, as I mentioned at the beginning of this presentation, we're starting that now to, again, make sure that we're using our resources as effectively and efficiently as possible to achieve the goals that align with your. I'll stop there. I know Commissioner Bonk had a question about one of the measures that I'll address, and that was the measure related to our vaccination rate for teenagers, where we have been doing very well with, I think, an actual in the low 80% range, and the goal for 2019 is at 54%. And so, no, we're not trying to do worse than we were. What has changed there is that now we need to include hepatitis A into that schedule of vaccinations that we're including in that goal. And so hepatitis A rates lag compared to the other required vaccinations. And so once we include that in our math, that is going to bring our number down, but give us something to shoot for going forward. With that, I'll entertain any questions.
All right. Thank you, Adam. Before we open it up for questions, could you just introduce your staff that you brought with you today?
Yeah, absolutely. Teresa Branson is the Deputy Health Officer. Everyone knows Teresa. She's amazing. And Christopher Mendecki is our Division Director in Community Clinics. And again, they're doing tremendous work. And they serve how many tens of thousands of people every year in the clinics? Just over 90,000 people when we include WIC and we include the vaccinations and personal health services, which is doing a lot of work with HIV and tuberculosis and all of the STIs as well. So they're very busy in the clinic.
Well, good, and welcome. All right, questions? Commissioner Ponstein, you had questions.
Thank you, Chair Steck. Adam, thanks for all your hard work and for your whole staff on everything you do. So the way you did the charts, I really appreciate it. The way you laid it out was different, and I enjoyed that. So with opioid deaths, do we track which ones are actually from Kent County or ones that have come from other counties to die in the hospital on the way?
Right, good question. So those are sorted out. So the numbers that I presented here are Kent County residents.
Okay, so now that we're tightening the noose around opioids and making them harder to get, we're starting to see an uptick of people going back to meth. Is that a problem that we should be concerned about? Because it's not just the people that are on meth, but the meth labs themselves, which are very toxic.
Yeah, that's a problem we're very concerned about. People choosing meth or heroin, which is an opioid off the street, and also cocaine. So we have seen our cocaine overdose rate go up a bit over the past couple of years as well. So yeah, we realize that we're not approaching the goal line with opioids. We may just be pushing the problem into some other areas. But overall, we're still seeing collectively fewer deaths now than were a couple of years ago.
Okay, and then just final, you touched on PFAS, and I was in the news the other day where they have found now just actual, not just chemicals buried, but old shoes and tannery that were infected with, not infected, but had PFAS in it that were found. And I always tell people that I don't think we have found everything yet. What is your thought on that statement about there's more to find?
I think that is absolutely spot on, but not just with PFAS. I think just in general, our understanding of toxicology has improved so much in the past few years. And we weren't even concerned about PFAS a couple of years ago. But if you look at what actually causes people to get sick and die, cancer is. Cancer and heart disease are head and head for what's the leading cause of death every year. And so much of the cancer is unexplained. And so what else is there going to be? And that's why when I talk about new and emerging issues, we weren't talking about vapor intrusion 3 or 4 years ago. We weren't talking about PFAS. We're going to learn more, and when we do, what do we do with that information? So it's challenging, but I absolutely agree with you. I think that many of the decisions that were made 30 or 40 years ago were made in accordance with the law, with how things were disposed, but our understanding of the science has just grown so far since then.
So Scotchgard is one of the culprits, and I read an article where carpet companies said that we're not going to use that anymore, which leads me to believe other carpeting manufacturers are still using it, and most of that carpet that has it are still in the homes. How toxic is that for an individual in a house that has Scotchgard on their carpet instead of wood floors?
I don't know.
Okay.
I don't know, and I haven't seen any research to look into that. But that's
Okay.
certainly
All right, thank you.
concern.
Commissioner Coleman.
Thank you, Chair. Adam, I'm just curious about the reduction in the rate of deaths due to drug overdose. Is that because the overall rate of overdose is going down, or is it merely because we're getting better at saving people's lives, but the overdose rate is the same?
If I had to pick one or the other, I would say it's because we're getting better at saving lives.
Okay.
When you look at emergency department admissions, those are also up in the past couple of years. So I think we've done a good job of getting the naloxone into the community, training how to use it. I hope we get to a spot, though, where the answer is the other.
Commissioner Melton?
Thank you, Chair. Thank you, Adam. I just have a question, or actually a statement. You mentioned the dust in the soil, and that we saw in the summer an increase in some of the lead statistics for our children. Do you think, and I'm just thinking out loud, and I guess I'm trying to give credit to a group of people that I think do a very good service, and that is the after-school programs during the winter that keep the kids occupied before they go home, as opposed to just totally it's being in the soil outside. I mean, I know I'm asking, I'm just thinking that it sure would be nice to send some nice kudos to this group of people that I think just do a tremendous, the ARCH program in Kentwood, I don't know what it is in other places, but that they occupy the students, they keep them engaged so that they are not home in an unsafe environment. Perhaps that has a play in it too, or maybe not at all.
Something to consider.
Yep.
And I should say that my commentary about it being likely linked to dust outside
Sure.
is really my hypothesis. But it is a hypothesis that's supported by quite a bit
Sure.
of literature.
Oh, I'm sure
and
it
we know
is.
that there's an awful lot of lead in the soil that we really can't do a lot about. But there are some things we can do,
Okay.
and certainly, programs like that help.
Excuse me, Adam?
Yeah.
Can you move your mic a little closer? When you speak this way, there. Thank you.
Absolutely, yeah, thank you. But certainly there are some other things that we can do to mitigate the risk during the summertime as well, and things as simple as how we clean in our homes.
Sure.
And that's something that we're working into the curriculum with our new moms and our home visiting programs, is how to properly wet clean instead of sweeping in some of these homes. And that is one pretty simple, low-cost strategy for keeping
Sure.
the dust down in the home.
Sure. Anyway, just wanted to comment on that. Thank you.
Commissioner Talon?
Thank you, Chair. Two questions, if I could. First one, Adam, it's been my impression that the health consequences to lead exposure, that we know a lot more about those consequences than we do about the health consequences of PFAS exposure. Would that be an accurate impression?
Yes.
Thank you. Second question. A few years ago, there was a significant vapor intrusion event in the Hall and Madison area. A number of things were done to address that, but I never, I was on a list, but I never heard what happened, where things ended up, how things are there now. What's the best way to follow up on that, to find out the status of a situation like that?
I can forward you information from the EPA that was their closeout summary, and that was the EPA or DEQ, but I can forward that
So there is a
information.
closeout thing that happens, and, okay.
There is.
Just never
and
saw
in
it.
Summary, they did the follow-up testing. They sealed the basements of those homes that were most affected.
Okay.
That's a huge concern to us going forward, because the same team at DEQ who was doing that response is the team that has been involved with PFAS for the past couple of years. And from what I've heard, there is a number of sites they would like to get back to investigating related to vapor intrusion around the state. So this is an issue that's going to come back to us collectively.
Thank you.
Commissioner Hennessy?
Thank you. Adam, I appreciate all that you have done and your department has done on the Viant and the ethylene oxide problem over there. You have been a really good leader in discovering and helping to, discover what is going on there and how we can stop it at the end. I am getting some feedback already based on the MLive article yesterday that, considerations that the fine itself is too low and that the operation will be allowed to continue until December 31st. And it does raise the question, there was another round of testing that was completed and that the results are back from, but yet we have not heard any report on, whether the emissions of this ethylene oxide have reduced, whether they're the same, whether they're getting higher. What has been, from the testing that's been done, what is the trend line?
I know they have found, they have detected ethylene oxide in all of the tests that I'm aware of, including some tests that were taken upwind from the Viant location.
Right, even as far as John Ball Park.
Yeah, but lower results. So the data does support that Viant is a significant contributor to increased levels of ethylene oxide. But I wouldn't want to categorize the results beyond that without having the data in front of me. And I will be speaking with our colleagues at Eagle to find out how and when we can release all of the data as quickly as possible.
Will that data be available before the next public hearing on October 23rd?
It's not my data, so I can't say for sure, but I would strongly encourage, and I will strongly encourage them to make that available. It's hard, as an advocate for this community, it's hard for us to expect this community to be able to speak up at a hearing without having seen the data.
Right, absolutely. And that is exactly what the neighbors are saying, that they want as much information going into that next hearing as they can have, available to them. I really do appreciate that you've had people working on looking at the correlations of cancers and subsequent deaths. But you might want to talk about the problems in trying to do this kind of study and, and how it's where you live when you die that becomes a very pertinent aspect to it.
Cancer is a very difficult illness to do epidemiology. Cancer is a very, very difficult illness to study epidemiologically because of that.
Can you elaborate on that?
Oh, sure. Well, how much time do I have? Well, first of all, because there are so many different types of cancer, it manifests itself in so many ways, and shortly also because the causative pathway for cancer varies so much. And any one type of cancer may have any number of possible precursors, and because it doesn't manifest itself as quickly as, say, foodborne illness, for instance, is very easy for us to investigate because we get 20 or 30 people, they share with us what their 30-day food history is, and we can use statistics to show exactly what the most probable food item was. With cancer, because we're talking about decades, and people have lived in so many addresses on average over the course of decades, it's very, very difficult for us to say whether or not it was ethylene oxide or was it genetics, or was it something that they were exposed to at work, or there are just so many possible causes and contributors to that it gets very tricky. Okay. And because the sample size that's needed to do that kind of work is so enormous, because the actual incidence or prevalence of cancer is relatively small for any particular type of cancer. So if we're testing for leukemia or bladder cancer, kidney cancer, the actual rate of prevalence is pretty small, so you have to have a huge population in order to do that, and then to find out where they're at now when you've got this time being a factor as well makes it very difficult.
Thank you. If I may, I have one more question, slightly different topic. Your numerical report here says the number of children less than 6 years of age with blood lead levels of the 5 micrograms or greater is expected to be in 2019 around 350. And is the incidence of these children, are they living in still the 49507 and 49504 zip code areas?
Yeah, we see the highest rate in those zip codes.
So that particularly, that's in the city, it particularly is of concern. And so what specifically are we doing to, how are we reaching these children and how are we handling these cases after we find them?
Well, I'd like to prevent them to begin with. So we have case management, that every time we have a child with an EBL, we have case managers that work with the family to make sure we identify what is the source of exposure in the home, to eliminate that exposure, and then to get nutrition and follow-up testing, and we follow them with coaching until that number drops to a lower level, below 5. There are a number of things that we can continue to do in those most vulnerable areas, and the National Healthy Homes Coalition actually just did a project in partnership with Save Grand Rapids, and they had a number of great recommendations, including making the rental program in the city look more aggressively at lead in those homes, which is important. Something that we're looking at is how do we improve our home visiting programs, because we think that that's actual prevention. If we can get to moms and families while baby's on the way and before baby's crawling on the floor, then maybe we can identify the lead in those homes and we can prevent the exposure before it ever happens. So we've got a grant application out now to partner sanitarians with our nurses and community health workers in those zip codes so that before baby comes, we're actually testing the home and identifying if there is lead in the home, how do you prevent the exposure to it? Abatement may be one way, but it might be something as simple as the cleaning techniques. It might be something about moving the furniture so that the little one can't chew on that windowsill over there because that's where the lead's at. So if we can give people specific information like that about their home before baby comes, that's one way we think we can help protect families.
All right, Adam, I want to follow up on one of the issues that Commissioner Hennessy raised, and that's the ethylene oxide. With the report coming back from Eagle, is that the last structured study of that event, or are there ongoing studies still looking at the nature, the extent, the impact of that exposure?
So environmentally, it's my understanding that they're continuing to take samples and will continue to sample beyond even December 31st if that is the timeline for getting it offline there at Viant. With the health component, I'm not sure that there's anything further being done at this moment in regard to health study, because the only data that we have, well, two sets of data. We had the survey data from the Westside Cancer Cluster study that we looked at last year, in which we did not find any significantly unusual rates of cancer, and also the work that we did with the state of Michigan looking at the cancer registry data, which also did not identify any unusual rates of illness. So at this point, there is no ongoing health study happening around Viant.
And when you talk about you're talking about the Eagle, so the studies that have been done or are going on are state studies?
In partnership with us.
Okay.
Yeah.
Right. Then the other question I had, I get asked this, and I've asked again in the last 30 days, it seems like. Our lead issues in Kent County, as you say, are principally related to paint exposure and dissemination through the community. We're not the only community, the only county that painted with lead-based paint. Why does it appear, and maybe it's just appearance, that we have such a more significant issue than other communities when it comes to lead-based paint exposure?
Again, I'm going to speculate here, but my speculation is that we have a demand for housing in Grand Rapids that is greater than many of these older, similar communities, and that we don't have any vacant homes in Grand Rapids any longer. Where I think that was one of the reasons we saw it spike 3 or 4 years ago when the economy improved, demand for housing increased with that. Where many of these other communities, their most marginal homes, their most poorly maintained homes sit unoccupied.
So does that suggest that to the extent that the existence of that lead in the paint and in the soils and so on, that we're maybe ahead of other communities in understanding the scope of that?
I believe so. I think we have also pediatricians and a network of healthcare here that is better in many ways than a lot of other communities. I think that there's greater awareness of the problem, and I know there's more testing happening in Grand Rapids and the greater Grand Rapids area than there is in many other communities of similar age and size.
Okay. Thank you. If nothing else, thank you, Adam, and thank you to your staff. I appreciate your report. All right, next item, number 5, is a submission for approval of funding from the Health Department. We have a motion.
Yes, this is a request to the Board of Commissioners to add 1 full-time public health nurse and 1 full-time outreach workers position, and to accept and appropriate $212,700 from the Michigan Department of Health and Human Services to the 2019-20 Health Fund budget. Recently, the Michigan Department of Health and Human Services alerted the Health Department that $212,700 was available to implement a Ryan White HIV/AIDS program to focus on expanding HIV services offered by the Health Department beyond HIV testing and counseling to include early intervention services. Persons living with HIV/AIDS often face substantial barriers when seeking diagnosis, counsel, and treatment. Offering EIS will allow the Health Department to provide consistent, timely support, linkage to care issuance, insurance and navigation, and referrals to appropriate community agencies, leading to a significant decrease in time between diagnoses and entry to HIV care. To support the work required by the Ryan White HIV/AIDS grant, 1 full-time public health nurse and 1 full-time outreach worker will be created. The cost and salary and benefits for each position is $78,600 and $54,100 respectively. In addition, 0.15 FT of existing public health program supervisor and a 0.055 FT of an existing epidemiologist will be charged to the grant for supervision and program evaluation. Total cost of these 2 positions for the 11-month grant period is $21,931. Travel, supplies, and overhead costs are $58,111. The grant period is November 1, 2019 to September 30th, 2020. It's expected the grant will be renewed for a minimum of 3 years. If funding is eliminated or decreased, the position will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations.
So moved.
Motion is made. Is it supported? Okay. Supported. Is there any discussion? Yes, Commissioner Skaggs.
Thank you, Chair Steck. Just a quick question, Wayman. There's no general fund money going into this. I'm reading this correctly.
Correct.
Okay.
It's all state funding.
Any other comments, questions? If not, we'll go ahead and take a vote on the motion. All those in favor say aye. Aye. Opposed, the same? It is approved. Next item on the agenda is miscellaneous. If any commissioner has a miscellaneous item. Commissioner Tallon.
Thank you, Chair. We received, I don't know if the entire board received an update, a federal priorities update. A couple of things regarding that. One is probably half of this are commenting on things that aren't part of our federal priorities document, and I want to encourage kind of a focus on what we've identified as our priorities. And in that context, the Medicaid exclusion piece, I really would appreciate some update on that, perhaps. And Mr. Chair, we've talked a little bit, I think, about how do we go after these priorities, and that's a pretty significant one for me in particular because of the work I'm doing with the Governor's Jails Task Force, and it's something we'll be looking at there, but really would like more information about how we can go about pursuing that change on a federal level, because it really affects us here locally.
Yes, and we have had conversations, Commissioner Tallon. I appreciate your pressing that. Would indicate that we do hope to have our federal lobbyist presenting perhaps next month or in the next few meetings as we have Becky report to us, we want to have him come in and also report to us. I think that's in part a response to that, and as well going back to identify what are the specific strategies that we and staff are pursuing to advance those, as well as advancing the state priorities. So we're going to continue to talk about how we can best communicate that update.
Thank you.
Yes, Commissioner Hennessy.
This morning, I was delivered my notebook for looking at the senior millage programs. And Chair Steck, you'll be on the committee, as will Commissioner Coleman. And this is the kind of book with information, all kinds of data, explanations of the programs that we'll be reviewing, along with meeting with each of the agencies that does receive senior millage funding. And so if anybody doubts that we don't put in at least a little bit of work to do this, here's the little bit of proof.
I got mine in a memory stick about that big, so it's not as daunting, but.
Put it on a memory stick, it'd be much easier.
I'm an old hard copy person, so I can mark them up easier.
All right. Anyone else, anything on miscellaneous? If not, I have a couple of things just to report. It is just about interview season for this committee, so we will be closing out the applications for many boards, authorities, and committees as of the end of September, and then proceeding with the process of making nominations to this committee and then to the full board. I have asked all of you to be willing to sit on one of these interview committees, and you've all indicated you would do that, either expressly or by silence, which I took as a consent. So I formed 3 subcommittees, and they are the following. Subcommittee 1, which is Ted Vonk, Jim Sawfield, and Carol Hennessy, and I've asked Mr. Vonk to chair that. The second is Stan Ponstein, Jim Talon, and Betsy Melton. I've asked Stan Ponstein to chair that. And the third is myself, Matt Coleman, and Phil Skaggs. And I asked myself to chair that one, and I've got to get back to myself yet on that. Touche. The allocation, I'm still working on the allocation because just simply taking the number of boards may not be the most equitable way of doing that, because some of these have many openings and some of them only have 1 or 2. So we'll refine the allocation of the open positions to the respective committees and get that out from Pam as soon as we close up and make that. The objective here is to proceed to do the interviews over the course of October and then wrap that up as quickly as possible after that. Though I believe there is one that we need to move on immediately, as I recall, Pam, and we'll follow up with that one. I think it's the DHHS appointment. So stay tuned for that. The second is, as I indicated, we are looking at scheduling our federal lobbyist to come in and address us on updating us on the status of his efforts with respect to our federal priorities. I'm not sure that's been secured yet, but we targeted maybe the October meeting.
Yeah, we're still waiting to confirm, but yeah, that's coming.
Okay, good. And then just update, there are some additional priorities that we have had conversations about. You'll recall that when we approved our priority statements, both state and federal, at the board level, we shortlisted some issues. And some of those shortlisted issues are still being attended to, and we're formulating what may be appropriate statements for this committee to consider. So stay tuned for that. And then the last is if anyone wishes to see advance notice of which of our departments are going to be reporting to us. We've set this format to have fairly significant reports from our key departments, as we did this morning from the Health Department. And we will have at least one key significant report for each of our meetings. And if you want advance notice of that, let me know and I can tell you what that is. And with that, if there's nothing else, we stand adjourned.
I am Kent County. I am Kent County.
I am Kent County.
We are 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 Kent County.
Beya, Kent County. Ami, Kent County.
Somos Kent County.
Mas Ira, Kent County.
We are Kent County.
We are Kent County. We are Kent County. Oh yeah.